Hey world, it's Dr. Walker from DentalWalker.com. Welcome back to the channel. Welcome back. Welcome back. Before we get too far into this video, if you like what we're talking about, give me a thumbs up, give me a like. Let me know that we are in accord with what you like. And I love what I'm doing. I love doing this part of the work. And if you like it as well, just let me know. Give me a thumbs up, give me a like, and follow if you can. Anyway, so vitamin D levels. I'll talk a little about why we should maximize those levels today. Now, there are some people that will tell you get your vitamin D levels up to 20 or 30 nanograms per milliliter. I think that's too low, right? And they'll tell you that's a normal level. And I think, it's like running your car consistently on almost empty, right? You want to maximize, get your tank filled as best as you can, maximize your levels, because we know that there is some protective factor when you have high vitamin D levels, specifically against things like colorectal cancer, breast cancer, lung cancer, pancreatic cancer, esophageal cancer, all of those things. And esophageal cancer and pancreatic cancer are two very disastrous kinds of things, right? So again, not that this is going to protect you from getting those things, but there is some protective factor when you have vitamin D levels that's high enough. And again, for me, my wife, myself, my kids, their levels are typically between 95 and 100 thereabouts. They're pretty high. Now there's things that's running around called turbo cancer, and the government doesn't seem to know what's the source of this thing. Now you and I may have some ideas, but we don't, right? We don't talk about those things in open spaces. But turbo cancer typically is a malignancy, or cancer typically would, you could live with chemotherapy and those kind of things for a couple of years, right? So some of those things now are you being diagnosed, for example, today, and there are some reports that you're gone in a week. And I've not seen that myself. I've not seen a situation where by some person has cancer today and they're gone in a week. I've not seen that. I've heard about those things, but I've not seen it myself. I have seen ones that's diagnosed today and in 3 months they're gone, or in 2 or 3 months they're gone, I should say. I've seen people with 3 different lesions, for example, in one breast. I've seen a lesion that was 2 millimeter, at some time ago, and typically 2 millimeter lesion, for example, in most parts of the body, we see them, we talk about them. If they're stable for a couple of years, we leave them alone. But I've seen them go from being stable for a couple of years, and then all of a sudden they're now a centimeter and a half, right? Those are the things that I know about. But anyway, if your levels are high enough, right, there is some protective force in there for you, which again, I suggest that you do. Now, before you do any of this stuff, obviously talk with your doctor to be certain that they're good with you maximizing your vitamin D levels, right? But I don't know why they would not be okay with that, right? It's good for helping with cancer, so I don't know why they would not want you to maximize your levels. Keeping it down by 20 nanograms per milliliter, to me, that's just disastrous, right? You want to maximize your level. But again, get with them, confirm with them that they're good with that. And if they're not good with that, probably I would be looking for someone else, right? Because to me, that makes no sense of why you should not maximize those levels the best you can when there's known some protection with high enough vitamin D levels. And I don't know why they would not want that. But also, remember that vitamin D3, you should also be taking then K2 and magnesium. Again, K2, if you're taking 5,000 units of vitamin D3, then it should be about 100 micrograms of K2. And then typically for most people, it's about 400 milligrams of magnesium taken at night, again, because it can help to relax you and help you fall asleep and stay asleep and so forth. So, but again, double check with your doctor, be certain that they're good with those. And again, anything in this day and age that helps you or give you some little bit of protection, right, against those terrible diseases, terrible things, I would suggest maximizing those, not minimizing them, just to have longevity in this. And again, turbo cancer, we've heard about it, we've all seen things. And again, I've seen it's just much more aggressive than you expect to see, right? It's just what people are seeing and what they're talking about. This, again, the source of those turbo cancer, no one seems to know. At least no one's telling us that there is a single source. But it's a new thing since 2021, really, and a lot of us are seeing it, talking about it, but no one really seems to know where it's coming from. Anyway, regardless, the goal, though, for you is to be certain that you can maximize. Now, I always tell folks, again, if I haven't said it yet, tell folks, before you start your vitamin D therapy, you want to get yourself a baseline, kind of see where you are, and you'll be surprised. You'll be surprised. I know people are going to go, I'm out there on, I'm walking every day, I'm out in the sunlight every day, I'm on the beach every day, and whatever else, and you will be surprised when you get your levels checked that you're not either at 30 or 15 or 10, right? And again, it's a simple thing, costs you pennies per day, right? That you can help protect yourself with by utilizing this. Just get your levels checked before you start, and again, you will be surprised. Just let me know what your levels are when you get them checked. If you get them checked as you start, I would be surprised if anyone is above 60 without actively taking a supplement. I'd be very surprised if anyone's above 60, right? And so again, a very simple thing you can do to help protect yourself. But again, initially, and then when you start your therapy, get it checked in about 3 months. Now, people will say that and I'm supposed to put an article here in the body of this, will tell you that when you start your therapy, again, after you know that your levels are down by the 20s, thereabouts in the pits, you can take 10,000 units, and you can do that for probably 2 or 3 weeks. Then you drop to 5,000 units, get your levels checked, and kind of see where your levels are. And then you can adjust up or down from that standpoint. I take 10,000 units every day, and my levels are typically 95 to 100. So, and I love it from that standpoint. But anyway, get it checked before you start. Get it checked in about 3 months, and you can probably then get it checked once you sort of normalize where you need to be. Get it checked maybe annually to be certain that it's good. It's one of those things, again, one of the basic things you can do to maximize helping your immune system as best as you can, short-term and long-term. Vitamin D, maximize it. And again, vitamin D, K2, and magnesium. I've talked about that for the last couple of years. But anyway, just remember, maximize your D3, K2, and magnesium levels just to protect yourself as best as you can. Thanks for listening. God bless. Take care.